Hi, everybody. My name is Anthony Zong, and I'm the Youth Committee Chair of First Aid on Site Foundation of America. And I will be today's webinar's co-moderator with Sophia Erbo. And this webinar is one of a series of webinars on healthcare-related topics. And today's topic will be going back to school during the pandemic and upcoming flu season. And this webinar will be recorded and also be broadcasted live on Dragon Eagle TV. And at the end of the presentation, we'll have a Q&A session. And Sophia, would you like to introduce yourself?
Good evening, everyone. Thank you so much for coming to the First Aid On-Site Foundation webinar. My name is Sophia Arabu, and I'm a high school senior at Detroit Country Day School. Our keynote guest speakers this evening are Dr. Patricia Paz Arabu, who is the Chair of Emergency Department at St. Mary Mercy Hospital, as well as Dr. Tijal Mehta, who is the Medical Director and Chair of Infectious Disease Department at St. Mary's Mercy Hospital. The final speaker is a fellow classmate at Country Day, which is Avi Desai, who is co-chair of the Youth Committee of First Aid On-Site Foundation and HOSA president at Country Day. The entire world has experienced great change over the last 7 months, especially with families with frontline workers. Many new challenges were presented to the entire community. Due to my mother being an emergency physician, I got to see those challenges firsthand. As most of the country's work life became virtual, healthcare workers had to go and work quickly to adapt new processes that were changing daily and new work attire that increased with PPE and other equipment, which is becoming harder to find during these times. Even in my own household, we had to adapt to new situations and problems that we never had to before. My mother would come home after a shift and change into new clothes before entering the basement, along with showering in order to reduce exposure to our family. Anytime she felt any unusual symptoms at all, she would immediately quarantine herself in the basement until tested for clearance. I know that my mother, Dr. Paz, and Dr. Mittal worked daily updating processes in the hospital with treatment plans and patients. They had to work in a changing environment and make quick decisions such as opening the drive-through COVID testing on the emergency department driveway and opening up new areas in the hospital to accommodate this influx of COVID patients. They met numerous hours during the day and after hours conversing for changes for the future. I am very proud to introduce Dr. Paz Arabu and Dr. Tijal Mehta, who were instrumental in guiding the hospital and community during this pandemic, as well as Avi Desai, who has an important presence in the community as leader and chair of HOSA and First Aid On-Site. Thank you.
Dr. Arabo, unmute yourself.
So sorry. Thank you, Sophia. And thank you for inviting me to this very important topic of returning back to school during a time that's anything but normal or routine. So I'm hoping that we can give you some tools. I've been a practicing emergency physician for over 20 years, and I'm the chair of St. Mary Mercy Emergency Department. I'm going to share my screen. We'll be talking about a few things that will be different now moving into the new school year and going back to school during a pandemic. So our back to school list has changed. Masks are going to be the #1 thing you will need to purchase prior to going back to school. Preferably a labeled mask. As we know, the younger children going back to school may find that they want to share masks with their classmates, and you want to make sure that if they set it down, it is named. A backup mask is important because if they play athletics, you don't want it to be wet or soiled, it won't be effective. Hand sanitizer will be an important backpack item. Greater than 60% alcohol is effective. Kleenex to cover their mouth and nose in case they have to sneeze or have allergies will be important to pack, as well as disinfectant wipes. Avoid sharing school supplies, things that you handle regularly, sharpeners, things like that. You don't want to really share, so try to buy your own and make that part of your backpack. Make an appointment with your pediatrician to have the early fall flu vaccine, and we'll be talking a little bit about flu and COVID as we are heading into that season. As far as masks, I get quite a few questions about masks. So first, why do we mask? We mask to source control. We mask to protect others. It's more to protect others than it is to protect yourself. It works well when everyone is masked. That is the point. You want to definitely be precautious when you're in indoor, unventilated areas, or if you're in dense populated areas outdoors. Wear it correctly. Wear it covering both your mouth and your nose. We've seen numerous. I'm sure we've all seen some of these. Do not wear your mask any of these ways. You don't want to wear it around your neck like a necklace, not like a headband, not under your nose or over your nose, not like a goatee, not an earring, and not a bracelet. This is not a fashion accessory. This is protection. We should not wear a mask. Who should not wear a mask? Under 2 years of age is not recommended by CDC. Anyone having trouble breathing, anybody with respiratory conditions that it would impair their breathing should not wear a mask. There's other options. Anybody incapacitated who can't remove it on their own should not wear a mask as well. The N95 masks, those are best reserved for hospital workers due to the high risk exposures. And of course, we saw during the peak of it, especially in March and April, that there was quite a limit around the nation. We were kind of caught off guard when COVID hit our nation. Cloth masks, that's the more commonly used. It's better to have fabric that's tightly woven, fabric that's cotton, more layers definitely preferred. You can add additional layers to the inside. You can buy disposable filters that you can place inside of those cloths. Some have little holders for them as well. They add additional layers of protection. Some are made with charcoal as well. Masks with exhalation valves, definitely not recommended. That's not helpful. It actually, if you are an asymptomatic carrier and you're not aware that you have COVID, you are exhaling through that and sharing that COVID virus with everyone around you. So not recommended. Here's some other, the gaiters. We've seen the gaiters are pretty popular among the young people, but as we know, those are not effective. It's single layer, it's stretchy. What happens is as the virus particle, if someone has it, as it goes through it, it gets broken down to smaller particles, and studies show that the smaller particles stay in the air and are aerosolized for a longer period of time. So in fact, they can actually worsen the COVID virus from transmitting to everyone around them. So not effective. We've seen the face shields several places. Our hospital workers use that face shield in a fashion with their N95. It should not be worn alone as protection. Special situations like glasses. So people who wear glasses have noticed that they fog up easily. So if you're choosing a cloth mask, you want to choose one with a metal bar that can conform and make a seal around the nose. And for the younger folks with smaller faces, it's difficult to get an adult mask on, but just make sure it fits snug. Just check it before your child goes off to school to make sure it fits snug and there's no gaps. And again, we're driving home the point, under 2 years of age, masks are not recommended. So how do you remove your mask? It's important to not cross-contaminate yourself when removing the mask. Hand sanitize your hands at the beginning and at the end. Remove them from the back. So you want to reach back there and take it off and lean forward as you're removing it. Avoid touching the front of the mask. Assume, because you won't know what is on the front of that mask, assume it is contaminated and avoid touching it. Pull it away from your face and then store it face down. One thing that I have shared with people is you can get just like a plastic disposable square sandwich box with a lid, and if you take it off and put it face down into that, you can cover it with the lid and you're not contaminating your car or other areas around you. And then when you remove it, it's already face down. Avoid touching your eyes, avoid touching your face. Those are mucous membranes, so easy to cross-contaminate. And then again, wash your hands afterwards. So I do get approached for, how do you take care of the masks afterwards? You buy them, you purchase them. Well, in order to kill the COVID virus, you have to have high enough temperature. So wash in the highest heat, and wash in the highest heat that that cloth can tolerate. Dry on the highest temperatures as well. Now, if you use bleach, some people feel better adding bleach. The color safe bleach does not have the adequate concentration to kill the COVID virus. So you want to make sure you get within this range here, bleach that contains this percentage of concentration of the sodium hypochlorite. So why are we doing all this? This is the data I pulled from Michigan.gov today. So this is how we spiked back in the peak. March, we ramped up, and those were rough days in Livonia. At our hospital, we saw a majority of patients during this time, but thankfully things had calmed down, and now we're seeing the ramp up again. And here we are in September. So although the intensity and severity of it, we're not seeing as much, thank God, as well as deaths, and Dr. Mehta will touch on that shortly. We still need to protect ourselves because there are immunocompromised people around us. We have all elderly relatives. We want to make sure we keep them protected. Mitigation strategies. How are we going to avoid spread? And it's important, especially seeing that we're peaking back up again. Avoid large gatherings if you can. At school, if there's large classes, try to spread out a little bit more. Physically distance, we hear the 6 foot, but it's actually, studies are showing that it can be carried a little further. So whatever you can distance even further would be better. And most people we found are transmitting, this is the interesting thing about COVID, they're transmitting the virus even before that they're aware of symptoms. So it has already occurred, the transmission, by the time they're feeling any symptoms. I dropped my freshman son up to Penn State, and I saw this campaign through Penn State, mask up or pack up. So you want to avoid closed spaces, avoid any non-ventilated areas, keep the windows open, areas where people will be exhaling quite a bit, like the gym, choir, those things. You want to be extra cautious during those. And as I touched previously, it can be suspended in the air, especially for several hours. So you want to always take precaution. Just because you're in a room by yourself doesn't mean that there is no particle in the air. So you want to just be very careful. Frequently wash your hands. And again, I'm going to touch base on this over and over again. Do not touch your eyes and your face. So we're going into flu and COVID season now. This will be the first year that we're going to actually talk about it together. And so there's some things that we need to know. The symptoms. So they overlap, unfortunately. So based on the symptoms, we don't always know which one it is. Fever greater than 100.4 is what we consider a fever. Cough, shortness of breath, difficulty breathing, fatigue, muscle, body aches, headache. Now this is interesting. The new loss of taste or smell, that's specific for COVID. Flu, you don't really have that shared as much. So that is one way some of our colleagues even have diagnosed themselves. They were not feeling very ill, and then suddenly they lost their taste or smell and got tested and realized that that was why. Sore throat, congestion, runny nose, nausea, vomiting. That's another symptom that wasn't really well known in the beginning. And as we progressed with COVID, we realized that these GI symptoms were actually a symptom of COVID-19, and diarrhea. So when do you come see me? When do you come see me in the emergency department? Things that you need to watch out for are chest pain or shortness of breath, difficulty breathing, pressure, abdominal pain. Those all need to be worked up. If you feel so weak that you feel like you're about to pass out, if you're feeling dizzy, having visual symptoms, if you're suddenly confused, any sudden severe pain is always a good reason to come visit me in the emergency department. Uncontrolled bleeding of any kind. If you have persistent vomiting or diarrhea, you might need some IV fluids. It's supportive care for all of these viruses. So if it's intractable, you want to come to the emergency department. Any coughing up blood or vomiting blood is always an ominous sign, so you definitely want that checked out. Difficulty speaking because you're so short of breath that you can't speak. And this one is something that I do want to make sure everybody's aware of. So there's something called MIS-C. So it's not Missy, it's MIS-C. And so what that is the multi-system inflammatory syndrome that we see in children. So fever that is 3 days or greater plus GI symptoms, or fever of 3 days or greater plus a skin rash or conjunctivitis. So that combination is something that you need to be aware and watch your children for. That could be a sign of MIS-C, so you should bring them into the local emergency department, and there's a workup for that. We do blood work, and we see if they are in that inflammatory state, and if so, they do need observation and admission and a little bit further workup, which Dr. Mehta will talk about. But it's important for people to be aware and armed with the knowledge of what to watch out for and when you come see me in the emergency department. So what do you expect? When you go to the emergency department, what do you expect? Do you see an astronaut like this person on the left? That's During the peak period of time, what I had to wear when I started my shift. So this is after changing and getting ready. We had to cover our hair. We had to wear goggles that made a nice seal around the face. Of course, the face mask, and then we had an extra shield over because during that period of time, Livonia did have high numbers, and so our emergency department was pretty much filled with COVID patients, and we had to do intubations and aerosol procedures like breathing treatments, which were much higher risk for anybody in the room. Thankfully, we're not at that time, we're not similar to that time at all. Our intensity of treatment is much different. On the right side picture here is my colleague, Dr. Chapman, and we had to implement a driveway testing, as Sophie alluded to. In order to handle the high volumes that came into the emergency department, we started this driveway testing. So patients would come, they would register, they would move to the next spot, and they would have their vitals and pulse ox checked for oxygenation. From there, they would be screened. And then once they're evaluated, if they were mild, which luckily most people were, they could be discharged to have the results sent to them on their MyChart app, and they would quarantine. So all of this happened pretty seamlessly. And they would be swabbed, of course. And we would do a send out, which usually took a few days in the peak of things. So they would quarantine until then. Now we're still continuing to do this driveway testing. It's a little bit different. We're doing a lot of back to school, back to work, mild symptoms. Thankfully, the intensity of treatment is not as much because people are not as ill as they were back in March and April. However, we can screen and bring them in. So what do you expect when you arrive to the emergency department? You expect people who are geared up with PPE. Anyone who arrives to the hospital, whether it is myself, staff, or patients or visitors, they all have to be screened at every entrance, and they're screened with questions and a temperature check. Everyone is given a mask if they don't have one. The nurse triages the patient to the appropriate setting, and then they're swabbed. So you're now going into fall season, you will be swabbed for flu and COVID as we get into peak season. So there's new treatments, new testing coming as well. Now, if your pulse ox is low, you might warrant a chest x-ray as well, and then blood work for the ill-appearing patients. During the peak of COVID, this is what we had to do. This is a portable chest x-ray that was done outside in front of the driveway. So when people would drive up and they were screened that they needed a chest x-ray, we were able to do it safely in an open ventilated area. As you see, there is no roof there. It's open. We were able to do it very quickly, and it was very safe because if you bring high volumes of COVID patients into the hospital, you are risking exposure to other patients, visitors, and staff. So for the mild symptoms, we were able to do a lot of the treatment outside, and people were able to be discharged home very effectively and efficiently. So thankfully, we said most people have mild COVID symptoms. So most patients are able to be discharged home, quarantine, and now the criteria has changed a little bit. It's 10 days from the initial symptom and 24 hours from the last fever, where you can go back and go to school or go to work. Some places are requesting testing, but we don't really recommend, and Dr. Mehta can touch on that later as well, we don't recommend testing for negativity. And the reason being is that a lot of times you have viral matter, particulate matter, still able to be detected by the sensitive testing. So although you are not transmitting, you may be shedding just dead virus, it will pick it up. So you will be quarantined even longer. And some people it's extensively long. Use separate bathrooms from the rest of your family. Disposable utensils, disinfect all high touch areas. These are all the things you want to do when you have mild symptoms and you're sent home. And if you test positive, or even before, it's good going into peak season, go buy home pulse ox. They're pretty inexpensive. You can find them at the drugstore, but it can really help you gauge if you become ill and require oxygen that you need to go to the emergency department. Patients with severe symptoms, they may be admitted to the hospital. They may require oxygen. Now we're doing IV steroids, dexamethasone. We're doing it earlier on than we did during the peak season. Some patients who cannot stop vomiting might need hydration, IV fluids. IV remdesivir, that's a broad spectrum antiviral agent that we use now earlier on in patients who require oxygen. Some people might have that convalescent plasma treatment that you all have heard of, and that's basically patients who have recovered from COVID-19 go to Red Cross and donate their blood, and the plasma can be used with the antibodies to treat the patients. And we've seen great results with all of the above. In the hospital stay, we are monitoring your respiratory status for any deterioration. And one thing I want to touch on, we've talked about the physical ailments, we've talked about the treatment plan, the clinical scenario, but I do not want to neglect the mental health wellness that is important during this time. Lots of students are going to be doing quite a bit. It's going to be a different way of handling stress of school, stress of quarantine or isolation. There's a lot unknown. So what do? You need to get your sleep. Now I have teenagers and I have a freshman college student, and I know over the summer, this was not a priority for them. So now that we're going back in, sleep is very important. You're much more resilient in dealing with stress when you sleep and are well rested. Nutrition. Hypoglycemia. I know when working on my shift, I get hangry. And so nutrition is very important to deal with all the stressors. Hydration. We've all heard of brain fog. There's a link. There's a link between water and cognitive performance. So keep yourself hydrated during the school year. One study found that drinking just 300 mLs of water boosts your attention, your focus up about 25%. And we know that our brain is mostly made of water as well, so makes sense. Exercise, keep your balance, keep fit, walk, dance, lift weights, do whatever you like doing. It doesn't have to be anything specific, but keep moving. It's very important. When you move, you have more oxygen to the brain. You also can focus, and we know all the benefits with physical activity. The brain secretes dopamine, norepinephrine, serotonin levels. All of these help your focus, your attention, your mood. It's just a win-win. So some other things that you can do to help de-stress yourself are things that we use, even in our emergency department. A lot of our staff does things. It's better to implement things that are just kind of a no-brainer. Automate things for yourself. Organize your study space at home, because there will be much more. Some people will be learning online. So keep that space uncluttered so it keeps your mind kind of at rest. Make checklists, use your Post-it notes, your dry erase board, cork boards, things like that to just keep things more automated. Plan ahead, schedule your meals, your homework, your exercise. If you schedule yourself, it just is a little bit less stressful for people. Have a system for tackling things by priority. And like I said, automate. We live in an IT world now that you can set reminders, you can have to-do lists, checklists, set alarms. Use all of those to your advantage, so it's one less thing for you to do. And then most importantly, because this is especially for the adolescent children, limit your social media and screen time. That in and of itself, studies show that that is a big stressor. It also takes away your focus, and also just you need some rest time for the brain. So try to limit it. Some take-home points. So younger patients are mainly mild and asymptomatic and can spread it unknowingly. So just make sure you always keep that in mind. Mask up. Any confined space can have small aerosols. Avoid touching your eyes and nose. Careful handling of your mask. Be very careful. The front of the mask is where you really need to be careful. Avoid close contact with your relatives that are elderly or immunocompromised relatives. And if you feel sick, even mildly ill, stay at home. Get tested, quarantine yourself, but don't go to school. And then finally, as we touched recently, keep your immune system strong and your mind healthy. Proper rest, activity, nutrition is really going to go a long way for you. So I want to thank you all, and thanks to our Michigan communities, especially First Aid On Site. They donated PPE to our emergency department. We received meals from all over the community. So I want to thank you all in the community, the Country Day community. These were my packages I found on my porch from different people in the Country Day family. So I really appreciate it from St. Mary Emergency Department. I can't thank you enough. Daily meals from all over restaurants, and donations were dropped off to the front of the emergency department. So again, thank you all, and please be safe. So I am going to turn it over now to Dr. Mehta, my friend and my colleague, who is the lead of the infectious disease department at St. Mary Mercy Hospital, who without her, we could not have dealt with that big peak that we had in March and April.
Hi, everyone. Thanks, Dr. Paz. Dr. Paz was amazing. So I know that there was a time where we were talking to each other like multiple times a day, many days, and it was just it was interesting times. So I'm one of the infectious disease doctors. I'm the infection prevention chair of St. Mary Hospital. I've been working at St. Mary for 10 years now. And this has been the experience of a lifetime, taking care of the hospital during the COVID pandemic. Something I never dreamt about, but it was amazing. So let me just share my screen. All right, sorry. You can see my screen now? All right, so I just wanted to plug in that this has never been an exciting time to be an infectious disease doctor. So all you kids out there want to go into infectious disease, come on in. It's been an experience of a lifetime, and I can tell you it's just so life-changing. Like, you're learning every day, and a very exciting time. So what I'm going to do is I'm going to tell you a little bit about COVID-19, the SARS-CoV virus. And this is just to understand the basics of the virus so that it can help you guys to understand why we are saying what we are saying, and also to empower you to say that what is coming in and how we can tackle this challenging time. So we're talking about the overview, virology, the life cycle, how it is transmitted, the signs and symptoms, treatment, the hospital experience, lessons learned, prevention and flu vaccination, and the flu season. So what is coronavirus? It is a virus that is related to the coronavirus's family, and it's like common cold, but the strain that we are having right now is much more contagious. In just a few months, it has infected millions, and hence we say it's the pandemic. Now, this is not the first time that we heard of a coronavirus. We've known about coronaviruses. Now, there are at least 8 strains of coronavirus. So the ones that you see over here, the 4 strains over here, are just common cold. And a lot of you may have had coronaviruses in the past and not even known about it, because first, we don't even test it because it wasn't that infectious. And second thing is that it was just like common cold. So maybe you had some mild symptoms and you wouldn't have even known about it. But what happened was we started seeing these more strains that caused more in mortality in patients where people were dying. So that was in 2003 where we first noticed the strain of severe acute respiratory syndrome coronavirus, which is the SARS-CoV. And it was from the bats, but it did spread to the whole world. But there was a lot of deaths at that time too. Then came 2012 MERS virus, which is similar to the SARS, but it was originated in the Middle East, and it was more localized in the Middle East, but that was also coronavirus. And now we have the SARS-CoV-2 2019. So the reason why it's called SARS-CoV-2 is because it behaves very similar to the SARS-CoV 2003. And that's why the name SARS-CoV-2. And 2019 was because in 2019 it was discovered, and we're facing it in 2020, but it was discovered in 2019. So I'm going to go through the virology, which is what the virus looks like. And that is very interesting to understand because each and every protein plays a role in how either we can protect the get a vaccine for coronavirus and how it attaches to our bodies and how it infects us. So I'm going to start with the main protein, which is the S protein. So you can see these spikes that you can there, which is called the S protein. It is the most important protein in the coronavirus. If you want to remember one protein in COVID-19, it is the S protein. That's something you're going to hear again and again because that's where we are targeting our vaccine as well. This is the most important protein that attaches to the host cell receptors. So it attaches to our body through these spike proteins, and it fuses into the host cells because of the spike proteins. Then you come to the M proteins, which forms the membrane of the virus. And then the coil-like structure is the single-stranded RNA, because coronavirus is a single-stranded RNA virus. And then you see these red red small little things over here, that is the envelope protein. The envelope protein, the interesting thing about it is it's made of these fatty layer, and once it comes in contact with soap and water, it breaks. So that is one of the interesting things about it, is that why are we saying wash your hands with soap and water? Because that will kill the virus, because one of the part is that the envelope protein, which is the fatty one. So that is about the virus. Now I'm going to go into the life cycle of the virus, how it gets into your body, how it replicates, and how it exits from the body and attaches to the other cells. So what happens is that there are these receptors which everybody will hear about, the ACE2 receptors, which are at different organs of our body. But what SARS-CoV-2, it targets mainly is the respiratory epithelium, which is your lungs and your mucous membranes in the respiratory tract. It does need the ACE2 receptors, and it has high affinity to the ACE2 receptors. So it attaches to the ACE2 receptors through the spike protein. It binds to the cell membrane, and it fuses inside the cell. And then you have these buds. You see these vesicles-like structures. Once it gets into the host cell, it is very smart. It uses your host cell machinery to replicate and form new viruses. And that is the interesting thing about this virus, is because it has the single-stranded RNA, it can replicate by itself. So once it forms into these buds, it starts uncoating, which means that it releases this main nucleocapsid, which is a single-stranded RNA, which has the protease enzyme. It replicates into double-stranded RNA and forms proteins. Once they form these proteins and it replicates, it attaches to this ER, which is not the emergency room ER, but it's the endoplasmic reticulum. And it attaches there, and the endoplasmic reticulum belongs to the host cell, and that helps to form the membrane proteins. Once they get the membrane proteins, they go into the Golgi apparatus, which helps to package it into small virions. And now you see these small virions that has become, it releases from the cell through exocytosis, and it goes on to infect other cells. Now, what happens to this host cell? It causes apoptosis. It dies, and it releases a cascade of inflammatory cytokines into the body. So when you're coughing, you're choking, you're having difficulty in breathing, that's because the virus has infected these cells and the cells are dying. And that is literally the pathophysiology of this whole COVID-2. And very important is that whenever we try to treat the virus, we are using different things, like we are using remdesivir to inhibit the replication of the virus. And then we use steroids to block the inflammation after the cells break down. So those are the ways we're trying to treat this infection. So how is it spread? It is very, very important to understand this. It is spread from person to person through respiratory droplets from someone who is infected. It can spread to others while coughing, sneezing, singing, or talking. It can spread from contact with contaminated surfaces. And like Dr. Paz said, even without symptoms, they can spread the virus. Now, if I can ask everyone to just focus on this one slide and understand it, because if you just understand this one slide, then you yourself will be, you won't have to question, why do I have to wear a mask? Why do I have to wash my hands? And why do I have to be at a 6 feet distance? So here's the pathophysiology. It's always get to know the science of why. So when someone coughs, you can have droplets, which is large droplets, which are more than 5 microns. And because of the size, they're usually like 16 or 20 microns, because they're like, when you're coughing big particles. And because of the size of the particles, they will drop down at certain distance and drop either into the surface of object, or you're just going to cough onto someone else who is around you. So that is where the droplet transmission occurs. So droplet is divided into two parts, that is direct and indirect. So direct is like if you stand close to your friend, let's say you're like, he doesn't have symptoms, but suddenly he starts coughing and you're not wearing a mask, he's not wearing a mask, he's coughing directly into you. And these are those droplets of viruses that are floating and going right into your nose, or you're inhaling it. Whereas let's say that you are far away from him, you're 6 feet distance, but he still coughs and it lands on the table and you accidentally touch the table and it's still viable, the virus, you accidentally touch your nose and there, boom, you've got it. So that is how it is transmitted through droplets. So that's why we are saying the person who's coughing, wear a mask, the person who's standing, who you're talking to, wear a mask, stay at a distance so that even if he's coughing, it doesn't come to you and you're protected by the mask. And then a lot of times I feel like people are very much into like, oh, I have touched his mouse, I've touched his bag, now what is going to happen? Just focus on the hand hygiene more than anything else, because you have to understand, Dr. Paz, me, work in the hospitals where there are so many infected people, and there are a lot of times we don't know what we are touching. Like if I have touched the curtains or the knobs of the COVID patient, so we're not wearing gloves all the time. But what we do focus on is frequent hand hygiene. We are constantly using sanitizers, constantly washing hands, and avoiding touching your nose and face. So those are the things I would focus on. There is a component, let's say somebody sneezes. Sneezes is like a mist. So that is not a droplet. So this mist-like particles are less than 5 microns. And that is where, supposing if he sneezes and you're in the same room, you may inhale the particles because they're suspended in the air for a longer period. So that is where the airborne component comes in. So if you can just remember the droplet, airborne, direct, indirect, you will understand why it is important to be at a 6 feet distance, because even if it is a droplet or airborne, with the 6 feet distance, we are hoping that is enough to help prevent the transmission. With the mask, you're blocking those virion particles by washing your hands, you're not touching all these surfaces that are contaminated. So it's really important to understand that. So that is why I wanted to spend some time on this slide. And this kind of just shows the same thing, which is the droplet, the transmission, the mobile phone, again, the same thing. So I'll just skip this one. Then comes the reproductive number. This is an epidemiological marker. You will hear this in the public health departments where they talk, what is the R0 number? So this is important to understand. It is usually in COVID-19, it's around 3. So which means that how many people does it take to infect the other person, which means that one patient with COVID will infect 3 other people. Each 3 of them will infect 3 more people. And that's how it exponentially rises. The best reproductive number is 0. Basically, you don't want anything more than 1. And anything more than 1 is a bad thing. So where in COVID-19, we are saying the reproductive number is 3, which is not good because, as you saw, it can exponentially rise very quickly. The worst is the measles virus. One person will easily infect 12 to 18. Each one of them goes on to infect more. So that is the reproductive number that we see in COVID-19. Interesting thing is the influenza has a slightly less reproductive number than COVID-19, although it is still there. It started in Wuhan. It was first discovered on December 13, 2019. Hence, we are stuck with the 2019's COVID. Otherwise, it's pretty much 2020, but because of that. This was just the timeline. Our first death in the United States was February 29, 2020. I'm going to skip this. The symptoms, Dr. Paz did mention, the already mentioned, the fever, cough, shortness of breath. Most of them are respiratory symptoms. Important thing to remember is the incubation period, which means the time that you get manifest symptoms. So supposing you are with your friend who was COVID positive, and you are like, oh, I got exposed, but there's no symptoms I'm having, I'm fine, which may not be true, because you might manifest symptoms after 5 days, and it can be up to 14 days. This is slightly different from flu, where the incubation period is up to 96 days. So it's important to remember that. And 80% have mild symptoms. Remember I talked about the ACE2 receptors? Now, the ACE2 receptors are at different organs of our body. So lung, kidneys, brain, heart, vessels. So what you have to understand is wherever the ACE2 receptors are, that's where the COVID virus can go, attach, and shut down that part of your body. So it targets the lungs primarily, but when we saw the really, really sick patients during the March, where the elderly people came, they were having kidney failure, they were going on dialysis, they were getting mental status changes, and they were getting heart issues. A lot of them were clotting away because they were attached to the vessels, there was inflammation. So it can have a multi-organ damage to your body once you get to the moderate and severe part of the disease process. I thought this would be interesting for you guys to understand how the CAT scans look like, because this is early and this is late. This is the lungs that we are looking at, and it should be black. That means the air. So in the early part, you see these white opacities. That's the infection part of it. And when you go down to the late process, you'll see a lot of the disease process just getting worse. So this is how bad the lungs look like. The treatment part, you start them on oxygen right away. Then the remdesivir is specific for the coronavirus, actually. So it's a specific antiviral medication that we have. The methylprednisone and the tocilizumab is to block the inflammation. Remember when I talked about the apoptosis of the cells and the inflammation and the cytokines? We try to block the inflammation part by giving steroids and the tocilizumab. The convalescent plasma is basically someone who has recovered, like Dr. Paz said, and has antibodies. We give that blood to our COVID patients so that they get the antibodies to fight the virus. The St. Mary Hospital, we had over 1,600 patients. In March, March and April was a peak, and interestingly, there was at least more than 2 weeks or two and a half weeks of time where I was the only infectious disease doctor in the whole hospital, and I had 96 COVID patients on my list. So you can't get more exciting than that. So it was very, very exciting. But it was scary because we had a lot of mortality. As you can see, 375 were discharged, 209 died. And that's because our hospital is around a lot of nursing homes, long-term care facilities, where a lot of our patients were from these facilities and had comorbid conditions and did not make it, unfortunately. This is an important slide to tell you guys. This is from St. Mary COVID-19 database. This is important to understand. The yellow bars are the live patients, and the blue is the diseased, which is they passed away. So what we notice is that by the time you hit the age 60 is when we started seeing patients having more that passed away and died because of their elderly age, comorbid conditions, whether it is heart disease, diabetes, COPD, but this is comparable to the national United States data, where by age 60 is when we see increased mortality in the patients. So especially when we tell you guys that, you know, be careful around your grandparents and around your elderly people, is because although you may have mild symptoms, but the same strain, you pass it to your grandparents or some other elderly people around you, they might have a poorer outcome because they're more vulnerable because of their comorbidities and even age by itself. So that is important to understand. This, I just wanted to say that how St. Mary Hospital grouped up with all the nursing homes and long-term care facilities, and we had a shared program where I went to the nursing homes and I explained to them how COVID virus transmits, what are the ways they can help prevent mitigation, how they can separate the patients over there, what are the PPE they can use. We asked the nursing homes, we have a whole ER team that went to the nursing homes and said what PPE they can give them, what are the testing supplies. So it was a very collaborative teamwork that we tried to handle the nursing homes, because it was going out of control, where there were so many patients who were just getting infected one after the other. It was like a domino effect, and they would just come to the ER. The ER was filled and the floors were filled. So those were the things we went through. This is how we started having the written instructions, how to wear PPE. We started having people understanding how to don and doff, cleaning, masking. This is how the teams look like. It always looked like a war zone where everyone is covered from head to toe. You can only barely see their eyes. Even the patients, this is how we boosted each other's morale, where if there were COVID patients that were made it and they were getting discharged, we used to line the whole floor and clap for them. Because they went through so much, and then we were just there for each other. So this is basically, if you had to ask me in one word, what was the experience like? I think it humbled us all. We did not know what to do. This was the first time we were taken aback, because if you come with a heart attack, you come with a stroke, we know what to do. But this is the first time we were struggling. So it was a humbling experience, and we were at a loss initially, and even now, in fact, trying to learn every single day. We are still learning. So now we have a new mindset that we are going to move forward with. We are doing just like you guys, you're preparing for school. In the hospital, Dr. Paz, us, every day we are talking about how the hospital is going to be prepared once the next surge comes. We have meetings, we have an emergency management, we are checking a PPE inventory, making sure all the doctors, nurses, everybody have good enough PPE in case we get a surge back again. And one of the interesting things which Dr. Paz mentioned was the multiplex PCR that we have at St. Mary. In fact, all the hospitals will be having that, because now we are not going to check just for COVID, we're going to check for flu, we're going to check for respiratory syncytial virus. So if you come to the hospital with flu-like symptoms, runny nose, fever, we will be doing one swab, and we will be testing for 4 viruses. Whether you have flu, whether you have COVID, whether you have respiratory syncytial virus. Now, one of the questions is, can you get both? Can you get flu and COVID? And the answer is yes. If you're unlucky, you can get even 3. So there's nothing like you can't have it. It is possible. So yes, keep your 6 feet distance, practice hand washing, sanitize, cover, wear a face mask, avoid touching the eyes, nose, mouth, and stay at home if you're sick. We cannot emphasize that enough. Again, cleaning, just continue cleaning, with the electronic devices, cleaning products. And this is for the schools, where I think one of the things is, when you're washing your hands, have these written instructions, diagrams spread all over. And something like what you're doing right now is getting educated and spreading the education around. If someone is sick in the school, they should be going home. What do we do if they come home? If they become sick in the school, things like that. So have a plan ready for everything. Continue cleaning the environment. I'm going to go through some frequently asked questions for COVID and flu. Is there a vaccine for COVID-19? And the answer is no, we don't have it as yet, but it is coming in. Should I wear a mask to protect myself? Absolutely, yes. Please wear a mask. How long does the virus survive on surfaces? I think the answer varies. Sometimes it's 24 hours, sometimes it's longer. But the key is to wash your hands and sanitize your hands. Can I catch COVID-19 from my pet? We do not know any studies that show that the animals are infected or they transmit it to humans. Who is at risk of developing severe illness? It is the elderly people, as I showed you in my graph, more than 60 years of age with comorbid conditions, diabetes, heart disease, and COPD, but the immunocompromised patients. Does antibiotics work for COVID-19? And the answer is no, because COVID-19 is caused by SARS-CoV-2, which is a single-stranded RNA virus. So it's a virus, and antibiotics works for bacteria. It does not work for viruses. So no antibiotics. What is the difference between flu and COVID-19? So there are two different strains. One is a SARS-CoV-2 is the virus for COVID-19, and flu is the influenza. You have H1N1, H3N1, different strains. They're different viruses. Will there be flu along with COVID-19 in the fall and winter? It is definitely possible because we're still having an uptick in COVID-19. We are yet to see what the numbers are going to look like, but just remember you can have both flu and COVID. In fact, in St. Mary Hospital during the COVID surge, we had at least 3 patients who had both flu and COVID-19. So they were double whammy. It was, beating up their body. Can I have flu and COVID-19 at the same time? Yes, like I said, there can be co-infections. Is there a test that can detect both flu and COVID-19? Yes, there is the test that we're going to be using, which detects both. Is COVID-19 more dangerous than flu? And the answer is, it is showing more mortality, but again, both can cause serious illnesses, so we cannot take either one lightly. Are there any treatments available for flu? And the answer is yes. We have oral Tamiflu, we have intravenous zanamivir, peramivir, so we do have treatment for flu, and these are proven treatments. What viruses will the 2021 flu vaccine protect against? The flu vaccine that is going to be coming up in October will protect you against 3 strains, that is H1N1, H3N2, and the flu B virus. So the normal people are going to be protected by 3 strains of flu. And if you're 65 years and older, we also give another vaccine which covers 4 strains instead of 3. Are there any changes to the vaccine from what was included in 2019? Yes, we have a different vaccine this year, which is based on all the research that goes on what is the most circulating form of strain that is going on, which really goes on to say that just because you took it last year doesn't mean you're protected. So definitely you guys need to get the flu vaccine this year to protect you from the strains that are going to be circulating this year. So the flu vaccines recommended this season is going to be the trivalent and the quadrivalent, which will be advertised by your doctors once they come on board. Do we need to get the flu vaccine earlier this year? And the answer is no. You get it during the time in October, and you want the immunity to last you all the way 2021, March and April. So don't need to go and rush and get it earlier. Will there be any changes in how and where flu vaccine will be given this winter? It is possible because of the social distancing that you will have to do. So that is something you have to find out early in advance. Does flu vaccine protect against COVID-19? And the answer is no. The flu vaccine does not protect you against COVID, but the flu vaccine will protect you from the serious side effects, from the serious illnesses of flu, which will help with the immune system in case you get infected with COVID-19. So it's important to get the flu vaccine because that's the best mechanism that we have to protect for flu. So fight flu, get a flu vaccine. The important thing is prevention, prepare, not panic, stay calm, be prepared. Also want to stress that get your information from reliable and accurate sources rather than buying into hype and misinformation. These are the websites I would recommend: the CDC, the ID Society, and the Shea Online. Also, this is something I feel is important, that one of our foundations of tackling this challenge is to be compassionate. So be kind, stay mindful of actions that could perpetuate discrimination or stigma associated with COVID-19. Keep calm and wash your hands. So please let us know what questions you have, and thank you very much for having us.
Thank you, Dr. Mehta. That was a very informative, very interesting presentation. But now I would like to turn it over to my friend and also one of my peers at high school, Avi Desai.
Hello, everyone. My name is Avi Desai, and I'm a student at Detroit Country Day. I am the president of the HOSA Club and a class board representative. Today, I'm going to be quickly mentioning what some schools are doing throughout the coronavirus pandemic and how you should handle yourself during school. This is just a really quick memo. So what my school is doing personally is giving our students a choice between online and in person. If you choose in person, wearing a mask is required at all times, and a student must be in the classroom at all times. Lunch will be delivered to whichever class you're in right before the period, so you'll be eating in your class. Each and every student must get a COVID test negative before attending in person. 6 feet must be maintained between students and faculty. Some of my friends that attend public schools have school online for around the first 3 to 4 weeks. Then discussions would be held of going in person. And some other public schools are fully reopening. Students, of course, must always wear masks and maintain social distancing. If you do feel scared or frightened of going back to school, just remember that your school will have precautions in place in order to maintain rules in line with the CDC guidelines. Make sure you retain social distancing and wear a mask at all times. If CDC guidelines do change, then still follow the school rules. The school will eventually change their rules to adapt to the CDC guidelines. And just remember, have fun. Thank you.
Thank you, Avi. And I think that will conclude our presentation today. And I would like to thank Dr. Erbo, Dr. Mehta, and Avi for a really good presentation. And everybody, make sure that you are staying safe and taking the precautions that we discussed today. And don't forget to get vaccinated for the flu as well, on a side note. And so now we are going to move on to our Q&A session. And I see that we already have 3 questions in the Q&A. So we can get started with that. And we're running a little bit short on time here. So we're probably only going to answer the first maybe 3 or 4 questions. And if anyone else has any additional questions, I will drop a link in the chat, and you can ask your questions through the link. It goes to the First Aid On-Site website, and you can ask questions through the link. So Sophia Leo asks, is remdesivir widely available now? So would Dr. Mehta or Dr. Erbo?
Yeah, so yes, it's not through the public health department. We can actually purchase it. The hospitals can purchase it, and we have kept a stock of remdesivir at our hospital. So we are not having any shortages of it, which is good. Yes, we can, it is widely available now.
Yes, at one time it was very difficult to obtain the remdesivir, and I actually remember at 3 a.m. meeting the courier in the parking lot and walking it up to pharmacy. That's how scarce it was, just to make sure that it arrived safely. So we're very happy that we have several vials available in hand, and we're using it earlier as well. So.
Yeah, we did get it very late in the course when we had a huge surge of patients. We did not have remdesivir. It was actually still in the trial. It was only when I think Dr. Fauci mentioned it in the press, and it was actually taken out of the trial and released to the public under emergency authorization. So there was a lot of stuff that went down with remdesivir early on. And now we're at a different stage where, yeah, we have it readily available.
So our next question is, death rates seem much lower now compared to March and April. What are the main reasons? Is the virus less deadly now, or is the treatment better?
I feel like the strain has died down because, I mean, we even have our elderly patients who do not have that much symptoms. And in fact, they come for UTI or they come for some other infections and we just check them and they have COVID, but they don't have any symptoms. So it is one of those things which is still evolving and we're still learning about it. But it does seem like the strain has become less virulent, I feel. And the demographics have changed because now it is more of 18 to 30-year-olds as opposed to the older people. So those are the things we are seeing. A lot of stuff we're still learning about it.
Yes, I agree. It's a combination of both. As we know, if the severe strain, it feels like initially we had that Italian strain that was just really killing several people. It makes sense logically. If it kills the host, then the virus will die as well. So it mutated, and it seems like, we're seeing, thankfully, a milder form. But also the treatment, Dr. Mehta has really been instrumental in treating even earlier than even before the recommendations were made. And we noticed just in our hospital that doing the steroids early, doing the remdesivir early, the convalescent plasma, doing that earlier on in the course made a significant difference. So it's a combination of both, I believe, as well.
Okay, so the next question is UV light effective for killing the virus?
So there was some UV light can kill it, but it depends on how much. There were some hospitals that when I found out they had some UV lights robots, I remember talking to Dr. Mehta about that back in the day. There's some UV lights that can go through hospitals. There were certain hospitals around the country that had it. And it can, how effective or the strength or intensity of it, I'm sure that there's some criteria for that. I have to admit, I did send my son to college with an air purifier that had a UV light in addition with the HEPA filter in it. So hopefully it helps a little bit. Do you have any other information on the UV light, Dr. Mehta?
One of the things we were concerned was that does it radiate the skin cells and cause it can cause cancer with the amount of radiation that is exposed. So that is something we need to be careful about, is our own, just not the virus, but is it damaging us and damaging our body as well? So we want to use something that is safe, and we really need more literature to understand whether is it just going to kill the virus and not affect us before we start using something like this widely.
So the last question was about gym class, and because we as Country Day School don't have a gym class in high school, so we personally don't have any rules abiding that, but we encourage you strongly to go check your own school's recommendations and protocol. Thank you.
Thank you everyone for attending today's webinar, and I'll put a link in the chat for if anyone has any additional questions. And if you have any additional questions, you can click on the link and you can ask your question, and your question will probably be answered pretty soon. So yeah, thank you everyone for attending, and thank you Dr. Erbo, Dr. Mehta, and Avi for speaking today. Everyone have.
Thank you for having us.